So before we start, I'd like to introduce my co-panelist for this morning, Ms. Karen Fleming. Karen Fleming is a professional practice leader for nursing at the North York General Hospital. And she has a background in pediatric nursing and has been serving the pediatric community for over 19 years. Karen has been an active advocate for and as partner with patients diagnosed with sickle cell disease since the young age of 12. She's also a former volunteer of Camp Jumoke, the Sickle Cell Awareness Group of Ontario, and the Sickle Cell Disease Association of Canada. I would like to welcome Ms. Karen Fleming, as my co-moderator for the first panel session this morning. And I would also like to introduce our esteemed panelists with lived sickle cell experience. First, we have Ms. Fitz-Ann. Ms. Fitz-Ann was diagnosed at 5 months old. And sickle cell disease for everyone around her posed an issue. But for Fitz-Ann, she's learned that it was an obstacle to overcome. Ms. Fitz-Ann is a member of the SCAGO's Patient Advocacy and Advocacy Council, and she's using this front to bring a change to the care received by individuals with sickle cell disease. Welcome, Ms. Fitz-Ann. I will hand this to my co-host, Ms. Karen Fleming, to introduce our next panelist, Ms. Karen Fleming.
Good morning. Thank you very much, Lannery. I appreciate being included in the panel today. And yesterday, certainly, it was quite a pleasure being able to and on behalf of North York General. So looking forward to hearing what the other organizations are doing and definitely listening to our patient panel today. I also want to thank Fitz-Ann for being the person who really was the star of our virtual simulation game that we chatted about yesterday as well. So thank you, Fitz-Ann, for that. So you've done Fitz-Ann. I'll go on to excuse me, is it Mayssa Attar? And so I hope, thank you that I get that correctly. She's the coordinator of the Hamilton Wentworth chapter of SCAGO and has a child with sickle cell. Given her family's journey with sickle cell, her primary focus is raising awareness about the disease in the community and helping the Sickle Cell Awareness Group of Ontario reach its goal of advocacy, education, and research. So welcome. And then our third panelist joining us today is Warren Amos. So he also is a sickle cell disease advocate for over 2 decades. So welcome, Warren. And also, again, great to see you. Thank you for participating in our patient panel as well. So great to see you, Warren. As a person with lived experience with sickle cell, he is acutely aware of the impact of this condition on everyday life. Warren's professional background is in the field of public administration, government level security, and law enforcement. And so welcome to our 3 panelists. And so I think we'll start off with Fitz-Ann. And so we'll just go in the order that we just introduced you guys. So Fitz-Ann, you can go ahead and put your camera back on, and our other panelists can leave theirs off for now, and we can start off with Fitz-Ann. So thank you very much.
Okay, good morning, everyone. I hope you're hearing me clearly. I just want to say thank you to everyone for attending this morning, because it's a Saturday, we could be doing anything else, but I'm glad that you all came out to be educated and to understand what we go through and the steps that are being taken. I do want to thank SCAGO, Karen, and all the organizers and everybody in charge for allowing us to have the time to be educated on the topics at hand. So I just wanted to say that to begin. We all know why we're here. Sickle cell is a big deal. And as a warrior, we all have good experiences and we all have bad experiences, unfortunately. So my personal experiences, the bad tends to outweigh the good. And this is why we're here. This is why we're here, to start changing and improving and bettering the system and working towards a brighter outlook for us as sickle cell warriors, for us as caregivers to those who are taking care of warriors. I know you heard it yesterday from my fellow warriors and the caregivers that were presenting that this is our life. This is what we go through. And we don't want to end up, our very last resort is to go to the hospital. One, because we know what we're going to get when we get there. And even if it's a good experience, we still want to carry on living life as we hope we could, rather than be stuck in a hospital, basically at the whims of those in charge. So I know that it was also mentioned yesterday that we have a lot more bad experiences, and I'm one of the warriors that can attest to those bad experiences. I've been labeled as drug seeking. I've been labeled as my pain is not valid because I'm on my laptop or I'm on my phone or I'm doing something else to take my mind away from the pain. I've gone to hospitals where they won't even look at me in the waiting room because either they're uneducated in sickle cell or they don't know how to help me. They don't know what I need. And it honestly sucks. I've been to hospitals where those in charge, they may have been staff that are older or they may have more seniority. They think they know it all. And even though I try to advocate for myself and my parents try to advocate for me and those around me try to advocate for me, they don't want to hear it. They think they know it all and they know nothing, because although you may know something about sickle cell, you only know what you're taught. But every single person, every single warrior that I've come across, we all have different experiences. We all lived different lives and we all go through this life with sickle cell differently. So I honestly hate the fact that we are all labeled. We are all expected to fit in one particular box. We are all expected to fit the one label that the nurse or the doctor or whomever is in charge may categorize us as. And it honestly sucks. It really sucks. I've been to hospitals where they won't help me. And it's sad that I have to have one hospital that I know if I go, I will get the care that I need. And it's a half an hour, 45 minutes away from me. Whereas the one that's down the street from me, they won't even look at me. And that makes it even more difficult for me to want to go to the hospital. That makes it a lot more difficult for me to want to receive the care that I need. Because I can't go, I know personally that I can't go 10 minutes up the street and receive stellar care and receive any form of help from those people. Because one, I don't know if they're uncompassionate, I don't know if they just don't understand, or they have their own biases towards what someone living with sickle cell is supposed to do, how they're supposed to act, what they're supposed to be going through. And I know that I can attest to this and my fellow warriors can attest to this. You can't label us. You can't expect us to all fit in your nice little box with a bow, and that's just what we are. Growing up, I've heard everyone that lives with sickle cell, that has been around those of us with sickle cell, the pain is comparable to being shot, or the pain is comparable to, the disease itself is comparable to having cancer. And unfortunately, if a cancer patient walks into an ER and asks for help, they'll receive it faster than we do. because we don't look sick. We don't look like we need help, or we don't look like we're suffering or going through something. And it's very sad. Like I said, I have had great experiences, and most of those good, great, fantastic experiences were before I turned 18. So the adult system has not been kind to me. It has not been kind to a lot of us. And it's sad that we know that there's one particular hospital, two particular hospitals that we can go to receive the care that we need. And this is why we're here. This is why we're here. We're improving. We are here to learn. We're here to understand. And I hope that it'll not only benefit me in my big age of 28, but it's going to benefit the kids that are coming behind us, the kids that are just leaving sick kids or the pediatric hospitals, because they need it just as bad as we do. Unfortunately, this is the life that we lead right now, and I hope that going forward, we can grow, we can learn, and we can take the time to understand, and those nurses can be compassionate towards us. I also want to thank Karen for creating the sickle cell game simulator, of which I was the patient for. And that just going through the script, going through the ideas and the biases, it's looking at it, it was very true to life. And it's kind of like I'm sitting there and I'm like, I've been through this and I've been through that. And I know the feeling of this and I know the feeling of that. And it's really sad that we are drug seekers and we are labeled as invalid. Our pain doesn't matter. Our pain isn't as intense as we say it is. I may say it's a 10 out of 10. They feel that I'm lying. And it's very sad, but I hope that not only this session, but also Karen's game simulation and all of that can help us to improve, because I would like to come on hopefully next year and say, I've had more great experiences than I've had bad experiences. So again, I just want to thank you all for being here. Thank you all for listening to me ramble on about my experiences. And I just want to thank you for taking the time out of your busy Saturdays to sit and understand and be with us.
Well, Fitz-Ann, you sum it up very well why we are here. When I listened to you just now, I said, this is it. And your experience is also in line with the study that we did, whereby a lot more caregivers are saying that the care their child receives in pediatric is not that bad, but the adult care is where the problem is. So, and you said it, we're here to work together to improve the quality of care that's provided, right? And I always say, a pain that is compared to terminal cancer pain, how do we not get the right help at the right time? So we're here to make that change happen. Thank you so much. And with what you've just said, I think the next person we should call will be Mayssa Attar, who is a mother of an individual, of a child with sickle cell disease. And I'm sure Mayssa wants a future with improved quality care for her daughter. Mayssa, over to you.
Hi. Yeah, so just hearing Fitz-Ann now really hit hard, because that's exactly what I'm worried about. And even though, yes, care in the pediatric world has improved significantly, like I can't really complain. Our journey at McMaster didn't start out so well. And I think by sharing, Mira's lived-in experiences and, these stories are very personal, but I know sharing them is really proves why the work you are doing, everyone here is doing, is really necessary and valued in that case. So as you know, Mira was diagnosed, or may not know, she was diagnosed with sickle cell at birth through the newborn screening, something, the news just devastated everyone in my family. So just gonna get through this without crying, because it's really hard to talk about, you know, things she's went through. So I think the first couple of years of Mira's life went without a hitch, and I started thinking that, you know, this was just a really mild form of sickle cell, like she was diagnosed, and you know, things were gonna be good. Unfortunately, just as soon as she turned 3 years of age, she had her first crisis, completely unexpected. She woke up at night to, she woke me up at night, and, you know, I was checking her out. She looked like she was gonna faint. So I called my husband, and, you know, he sees the same thing. We call for an ambulance. Paramedics come, and they assess her, and, you know, oh, mom, she's fine, she seems fine, you know, everything looks fine, her vitals are normal. I think they were in my house for about half an hour, just chit-chatting, and I'm trying to tell them, you know, she has sickle cell. Like, I know what I saw, and I was just really, really, really worried. So they gave me the choice. They're like, if you want us to still take her, we're happy to do that. But, you know, just feeling that they made me feel like I was exaggerating what I saw, or, you know, it's 3 o'clock at night. She's probably tired and needs to sleep. So I was like, thank you very much. I got this. I drove to Mac, and it was the same thing. The nurse was like, you know, it's late at night. She's probably just tired. They just weren't listening. And I kept pacing back and forth. We waited in the ER, I think for like, I don't know, 4 or 5 hours. And every time I grabbed the nurse to say, hey, you know, I really don't think she's feeling well. Like, this is not normal. Oh, mom, she's just sleeping. It's late. She probably had a rough night, you know. I even grabbed the nurse at one point. Her breathing was changing, and I can tell because I've been watching this girl like a hawk, let's say. And I'm like, her breathing has changed. The nurse said to me, it was her shirt, the way her shirt was, it's moving her chest up and down. Like, honestly, I don't even know how to express that day and just how horrible everything was. So eventually they come, they do blood work, and next thing you know, everybody's in the room. She's being moved into another room. Doctors are there, people from X-ray and ultrasound, and they're hooking her up. It's like, oh, she's bleeding into her spleen, her hemoglobin has dropped, and she needs a transfusion. And within a few hours, surgery was up in the room, and they're like, oh, we may need to remove her spleen. Like, how could this be happening? I just really did not understand, you know, the realization of I could be losing her. And this is happening in Canada. And it's happening because a paramedic didn't know what sickle cell was, you know, or because they did not just believe that, you know, my daughter was fainting, or I don't know, they just didn't know what to do, or they were just really busy that day, whatever it was, like, it's happening. And unfortunately, you know, Mira recovered after this, but once, as every doctors knows, you know, when you start to bleed, when this episode happens, it happens over and over and over. And then eventually, you know, it was made, we made the decision that we needed to remove her spleen. But, you know, like, I think the hardest part was coming to emerge every single time was questioning myself. And, you know, you go, there's a battle in your head, like, are they going to believe her this time? What's going to happen? Is she going to be sick? Is she going to be making it? Is she going to end up in the ICU? So you're asking yourself, and then you come to emerge, and instead of like getting help and reassured that everything's going to be fine, I've had doctors say to me, oh, you know, her history is really impressive, but I don't think we need to do anything. She's fine. And I've actually gone home, and within 5 hours, I was back in Emerge with a full crisis. So I just honestly, like at that point, I remember saying to the doctor, what is the point of us coming, doing all these routine checks when they're well, and then when we come to emerge, you know, you dismiss us like it's nothing, you know, you don't take it seriously, you're not willing to see what could happen if this child is left untreated or not monitored really. And I think, you know, just having Mira for the last 13 years, really early intervention reduced just how long she would be sick for. Because when I took her in, when she's already had a fever, when she's already had a cough, when she's already like has pneumonia, her visits in the hospital lasted week, 2 weeks, you know, up to 3 weeks. And when you go in, just when she's starting a cough, she's given antibiotics, she's put on an IV. We're there for 2-4 days, and you know, we go home. Recovering at home is usually shorter period. So I just honestly, I just did not understand. And if it wasn't for the 3F clinic and people like Jen, who were just so kind and so compassionate and just really helped me hold it together all this time, I really don't know what I would have done. And Jen introduced me to SCAGO, which was, you know, no-brainer. Like as soon as I found out like this was happening and there's people fighting to make change and wanting to make change, you know, I knew I had to volunteer my time and help be part of that change, because I don't want my daughter to go through what Fitz-Ann is going through. I don't want her to have to faint, you know, before an ambulance gets called. Or so thank you. I think with that said, thank you very much.
Wow, Mayssa, thank you for really saying it's listening to you. It's just, it's heart-wrenching, honestly. Thank you for being brave to share your story with us, because we do often hear that pediatric care, that it is, you know, that pediatric care is good, and you know, it's the adult area that really needs attention. So it's good to know across the board there's opportunities for us to really change what we're doing. Unfortunate to hear that that was the experience you had, but I'm really happy to know that others have heard it now, and we have, you know, just an additional piece of information, additional story to help drive our efforts. So thank you very much for sharing. Warren, if you wouldn't mind coming online now, thank you for your part.
Good morning, everyone. In the interest of time, protocol observed, terms moderator, and all the rest. I, as you're aware, have been born with sickle cell. My story is a little bit different because I grew up in the Caribbean, and I experienced pain intermittently over the years growing up. It wasn't until I was in my 20s that I found out that I actually had sickle cell itself. Perhaps because of the infrequency of the crises and the warmer weather. At the time, I was being treated by Dr. Graham Sargent. He is one of the pioneers of sickle cell, as it were. There was a clinic that I attended, and I got quite a bit of information about the way forward, because I was still in disbelief at the time because of the nature of what it entailed and what the future looked like. When I came here to live in Canada in 2005, my family doctor had some cursory knowledge of sickle cell, having practiced in East Africa. But outside of that, it was just the regular painkillers, codeine, rest, and fluids. Now, things took a turn in 2007, and this is one of the reasons why I want to emphasize this, because of the lack of information. I had developed gallstones because of sickle cell. As you know, the red blood cells break down and whatnot and form stones in the gallbladder. And I was on the surgical table, getting ready to have my gallbladder removed at a hospital in Durham region. And it was the anesthesiologist, when he was about to administer the anesthetic, looked at my blood work and he said, no, we can't do this today because there wasn't sufficient information about my red blood cell count. Everything was prepped, everything was ready to go. Nothing was done prior to that time in terms of getting me ready to be, well, no, I know that now, but at the time they were willing to go ahead, and the anesthesiologist said, no, we don't have any current blood work. And given that it stated sickle cell, he said he could go ahead, or he wouldn't proceed with the anesthesiology to proceed with surgery. Fast forward a little bit later, in 2013, I developed splenomegaly. And again, I was in a hospital in Durham region, and I was there for about 4 days. I was just being plied with painkillers. Nothing was being done. My stomach was distended. I looked like a pregnant male lying in the bed with my stomach up in the air, and nothing was being done. Were it not for some quick thinking, I was transferred to Toronto General Hospital. During that time, I didn't realize how low my red blood cell count was. And it took me, which is a surprise to me now, given the frequency of blood transfusion. I didn't have a blood exchange until being there for 2 weeks, give or take. And that's the part that surprised me the most, because of how common a blood exchange is. And I'm getting that information now because every surgery that I've done subsequent to, I do a blood exchange before I even start doing the surgery itself. So that was a bit of a surprise. But there was some back and forth as to whether or not I should have gotten the blood exchange. And in retrospect, when I look at it, I thought that was at least on the even on the mild end was a bit insensitive, because having interacted with that unit of the Toronto General Hospital, I do realize the access to blood transfusion, and that would have been an easy process. But what stood out in those two instances was, one, the fact that my own family doctor, and just to go back a bit, it was after that 2013 surgery that I realized that there was actually a red blood cell clinic that I needed to be a patient of. And we're talking from 2005 to 2013. That's 8 years, not having anyone monitor my blood work. My own family doctors in Durham region, no one at the time thought it necessary to refer me to the red blood cell disorders clinic. Had I not been hospitalized in Toronto General, I would not have even known about that. That for me was one of the points that I realized that within the medical practice, and of course I'm mindful of best practices and all the rest of it, but in terms of patient care, I've been in the system for 8 years before someone realized that, yes, I needed to actually be monitored by the red blood cell disorders clinic. And it was at that time in the hospital, and when I was asked to be a part of the patient forum in 2014, that I interacted with SCAGO. Many thanks to Landry and the persons in that organization as well. I was able to be put into some form of steady upward care, as it were, to ensure that in the future that, and yes, I have had two surgeries since that surgery to remove my spleen in 2013, and doing phlebotomies and exchanges and all the rest of it. It surprised me, even now just sitting here, that the level of lack of knowledge, as it were. Now, I'm mindful, like I said before, I do understand the administrative aspects of healthcare, their best practices. There's the entire Ministry of Health, and of course Health Canada, but in the interest of patient care, I'm asking to be mindful that patients do know what they feel. And yes, it might go against best practices, but at the end of the day, it's always more advisable to at least hear the patient out. Because this is something that across the board. I'm a part of the WhatsApp group with persons who have sickle cell. And as well, it's the same thing across the board. Doctors and nurses seem to not be as alert to what the patient actually says. I mean, sure, I get it, you know, the opioid crisis and all the rest of it, but just listening to a patient, hearing them out, even if it goes against best practices, even if it goes against the best practices, it doesn't hurt to hear them out, because that seems to be the common thread across the board. You know, I guess we've lived with pain for so long that we know how to manage pain, because nobody wants to be crying in the ER or being hysterical. And more often than not, persons will remain quiet for, you know, in the interest of decorum and decency. But nobody really wants to see when a person who has sickle cell cried. I've cried many times, many times, and I wouldn't do it in an ER just for the sake of not wanting to create any undue attention. But the truth of the situation is simply this: if someone presents at the emerge with a crisis, believe me, they don't want to be there. I myself have gone to great lengths, you know, and thankful to Dr. Ward for in terms of working with me so that I don't have to actually go to the ER. One, it's not so much the care in and of itself, but it's a lot of time that you stay there. You stay at the ER sometimes 4, 5, 6 hours. If I can spend that 6 hours at home, resting in a more comfortable environment with the necessaries to do so, I would gladly do that instead of going to the ER. And truth be told, when persons present, we don't want to be there, like I've said before, but we have to go. At least that should count for something. And if someone says sickle cell, I do believe there should be some protocol in place that once that happens, persons are able to get treated as quickly as possible. But of course, knowledge is power. And that's why we're here today. And that's why I'm sharing my story. So thank you very much for listening, and have a great rest of the program.
Great. Thank you. Thank you all very much for joining us and for sharing your powerful stories. The power of a story cannot be denied, and hearing directly from those who have had, you know, personal experiences with the emergency departments, with surgery departments, you know, pediatric centers, adult centers. It just really helps build up, I feel like, just the fuel to continue burning the fire. It's unfortunate truly that we have to continue this fight. We've heard the stories, these stories have been the same stories for so many years. As you know, like I think about Fitz-Ann, like when, you know, she's still in that pediatric, well, no, she's you know, now in adult stage. For her pediatric year, most of her life was really embedded in the pediatric years, but those stories were still prevalent then, right? The stories around the experiences of patients with sickle cell. So really hoping to change the stories. The stories are changing. We know this. Chicago's been a great help with that, you know, a leader advocating and helping to make change happen. And so one question I have for the panel, if we can get the panelists, please, if you guys could put your cameras back on for a moment. I am really interested, well, I want to see your cameras on. And okay, great. So one question I have that I heard through each of you kind of bring up was this disbelief that you are struggling with from healthcare providers when you present to, whether it's the eMERGE or other. I'm interested in knowing, like, how do we truly help break that disbelief? Like, how do we help you to go to an eMERGE and then be able to, like, and I heard a bit of it, like the order sets and education, but how do we right now bridge that you're able to increase that belief? Like, how can we help arm you with what you need so that people believe you immediately? I'm interested in hearing your thoughts.
Well, for me personally, I think medical alert bracelets could possibly be an answer. That seems to be, you know, I guess the standard by which emergency personnel, EMTs and doctors would automatically give some credence to whatever it is you're saying. If that medical alert was said exactly what it is that you were dealing with, then I think they would act accordingly outside of actually taking an individual's word for it.
Thank you. What about you guys? Fitz-Ann and Mayssa, do you have something to add?
I think, sorry, do you want to go first?
Go ahead. I'll go
Okay,
ahead.
so I think for pediatrics at MAC, now, you know, we have the alert cards, calling ahead hematology, like all these things I did not know before. I was just learning how to even, like, what am I dealing with? You know what I mean? And and having communicated every experience that I went through, really helped how we were perceived in the ER, because now when I go, one nurse will come right away and say, is Mira is Mira having a crisis? And sometimes, you know, I think you guys talked about this yesterday. I'll have a nurse, you know, if I say she's coughing, literally go back, get an x-ray before they even, because she's had so many pneumonias, like, and she just looks well, you know. I don't always go in with a fever or, you know, her having fainted or whatever. Sometimes it's just a cough and just how she was behaving the whole day. So I really can't complain now, but you know, things need to, and what really helps is having the emerge doctor who attend to her know what sickle cell is. Like, it's a difference of night and day when a doctor walks in the room and literally just says to me, we're gonna take care of her, no questions asked, and then they walk out, and then the nurses follow, you know. Like, this is the biggest thing. If the doctor is just sitting there, you know, telling me like, oh, do we need to babysit her? Just imagine what the nurse is doing. They just, you know, they really don't care. You know, like, the doctors have to lead so that nurses can, you know, do their jobs properly or take what we're saying seriously. So I think these things have been fixed at MAC, but, you know, I haven't been anywhere else to tell you if they have the same protocols or if they are working or not. But yeah, I just hope the same will happen in the adult world. So thank you.
Another, and this is my concern more than anything else. I've often limited travel. I have family members in other provinces, and one of the things that has been a concern of mine is whether or not I'd get the same patient care as I would at Toronto General or St. Mike's, or for persons who have children at sick kids, who basically, that's where the nucleus of patient care as it relates to sickle cell. Now, I do know that job, you know, working in the hospital is stressful, and I wouldn't, you know, I don't think any particular nurse or doctor would deliberately not be caring as it relates to patient care. And it tells me then that it's more of not knowing sufficient. I was heartened when we had the patient forum. There were nurses from the Toronto General Hospital who work in Emerge. They were there as a part of the forum, but we haven't had a forum in many years. I would like to see that replicated in perhaps other municipalities as well, to ensure that at least there is some widespread knowledge amongst individuals who want to do good at their job in the hospitals, but perhaps the knowledge of what it requires and the knowledge of sickle cell itself, what it requires to, what's required to be done when someone presents at the emergency room. So I think that is where I'd like to see an expansion in terms of it shouldn't be, because to be honest with you, when I lived in Durham region, I'd still go to Toronto General Hospital. And it's a long journey, but I'd rather do that because I do understand there is some understanding of what it is that I go through. And that to me, I'd like to see that replicated in other hospitals as well, further out of the GTA and in other provinces as well.
Exactly. It's such good points you're bringing up around the centralization of knowledge and how do we make sure the centers outside of the downtown core hospitals, how do we, or, you know, MAC, it's a tertiary center, like how do we ensure the centers that are not tertiary, that are the community hospitals closer to home for many, how do we ensure they too have those same information? Thank you, Lauren.
I must say before, as it were, it doesn't have to be the major hospital, because if you visit Taibu in the Malvern area, there is a wide swath of individuals who are knowledgeable and are able to take care. So even at that community level, that would help as well in more areas.
I agree too. Like collaborations with, Taibu as a CHC, whoever it's coming from, expertise wise, I 100% agree. But how do we truly get it out to those centers that have that expertise, sickle cell team or that sickle cell clinic, and drive care. Thank you. Fitz-Ann, did you have anything to add there related to things we could attempt?
I think for me personally, I've been to various hospitals in the GTA, out of the GTA. I've even been to hospitals out of the country. And I think it's accompanied with what Warren and Mayssa, I hope I'm pronouncing that correctly, was saying. It's education, it's understanding. So the order sets and the care plans and some form of identification is great, but I also think it's compassion. Because I've had nurses, even if the doctors don't want to agree with me, I've had nurses that are like, you know what do you need as a patient? And I think just that, it literally had me and my mother looking at each other like, what is this? This is new. But just that compassion. And because I've been to hospitals where it's 100% capacity, it's full, it's busy. And I've had nurses that are like, I'll get to you later. I don't want to deal with you right now, because they're just so overwhelmed. But I've also had 100% capacity, busy ERs, busy inpatients, and they're like, you know what? I'm gonna take the time out. What do you need? So it's education as well as having that heart for something. Even if you don't understand, a question is a question, and it's easy to ask a question, and it's easy to take the time to, even if you have 2 minutes to be with me as your patient, what do you need from me? I will go grab it. I'll be back in 10 minutes. What do you need? Okay, you have sickle cell. What does that entail? What are your specific symptoms? What do you go through as a patient? So it's understanding, but it's also understanding that we're humans. We need the same things that you would need. So that's just my personal way to look at it.
Thank you, Fitz-Ann. Thank you, Warren. Thank you, Mayssa. I think everyone on this summit today has listened. They heard you, and I believe the care providers, the hospitals are taking notes, and there will be changes. Before we go further, I would like to quickly thank one of our Ministry of Health representative that is attending today, Mr. Delani Ice. I think we also have Mr. Rodiana Bahubeshi also attending from the Ministry of Health. Thank you so much. And we know that you're taking notes as we all are working together to improve, the standard of sickle cell care in our province. Toronto, Ontario, as a province as a whole, has always been, in my opinion, a leader in a lot of things, right? So let's be a leader in ensuring that sickle cell care is optimal in this province. Thank you.